Welcome back to your director class. I can't wait to share what's going on here. We are updating our video on regulations, so I might look a little different than you've seen before. So let's go ahead, grab your From Overwhelmed to I Got This. We're on the chapter, Who's the Boss of You? Now, okay, so ignorance of the law is no excuse, dummy. So it doesn't matter whether you know what the laws, what the regulations are relating to childcare in your locality, in your country, in your state. You have to act within accordance to those laws. So we're going to talk a little bit about how to find those laws and what some of the big picture laws are in general, because I don't know exactly where you're located. So I can't talk about the specifics, but I can tell you where to find that information. Uh-oh. There we go. So the first place that we're looking is going to be for federal agencies. In this case, I'm going to be talking about the United States, but if you're somewhere else, this will probably still apply, but let's talk specifically about federal laws in the United States. They are broken down primarily into these four areas as far as what relates to childcare. There are a whole bunch of laws relating to employment. Those will apply to pretty much anybody who has employees, whether they're in childcare or not. But when we're looking at what are the concerns of those regulators when looking at childcare, they're mostly worried about, are we paying them appropriately? Are we following whatever minimum wage laws, whatever fair labor practice laws are applicable? And in the case of Occupational Safety and Health Administration, they're worried about injuries to the foot and ankle, injuries to the back, repetitive stress injuries, and of course, disease transmission, because people in our line of work are exposed to way more human beings than people, say, working in landscaping, right? So we need to make sure that our employees are staying healthy. And that means that we enforce the if you're sick, you stay home rules for both the kids and the employees, and that we have appropriate masks and Band-Aids and hand washing stations and things like that to ensure that everyone stays as safe and healthy as possible. So when we're at the federal government level and we're looking at employment law, there are a whole bunch of them. If you don't have any background in HR, you need to find someone who does. It doesn't need to be you, it's who. Who knows that information? Maybe you have a payroll servicing company and you can ask them to get you more information. Maybe they have an employer manual, a lot of them do, to make sure that when you are answering reference calls, for instance, that you are answering the 3 questions you're allowed to answer in a reference call. You're going to verify their pay, you're going to verify their employment dates, and are they eligible for rehire? Anything else they ask, you can't answer. When we're calling to check references, we can ask more questions because maybe the other person isn't well trained and doesn't know what else they could say. But in your situation, what we're looking for is for you to be in compliance and for you to answer just those 3 questions. It's part of why we ask for both personal and professional references, because the professional references probably do know the rules, and the personal references are not bound by those rules for confidentiality. Sometimes people get confused and think that childcare has to comply with HIPAA laws, Health Information Privacy Protection Act. Yes, I remembered all the letters. HIPAA actually is only relevant to people who are healthcare professionals. So if you have a nurse on staff or someone else with a medical license, it will apply to them, but it does not apply to childcare in general. But privacy laws do. So we do need to protect the privacy of our employees and of the children enrolled in our center. And that includes medical information, which includes the child's development and any injuries or illnesses for that child. Okay. So that's definitely part of federal privacy protection law. Let's go on to the next big category in federal law, which is child safety. So there are child safety laws involving how children can be transported in a car, on a plane, on a boat. So there's transportation safety laws about transporting children. And there are also child safety laws related to work. At what age can they do what kinds of work? And the one that we come into contact with most often is the child safety laws related to abuse, neglect, and molestation. So, according to federal law in the United States, anyone working professionally or in a volunteer capacity with children is a mandatory reporter and must report any signs or symptoms of potential child maltreatment. This law also requires that every state have some sort of child protection agency, and that's who you're going to reach out to. Different states have different ways of reporting. All of them have phone numbers. Some of them also have websites that you can use. It's up to you whether you want to use the phone call or the website. Do what works best for you, but you and all of your employees are mandatory reporters. The next section is about food and medication. So the FDA and the USDA. So how much medication can be given to children needs to be on the labels of any medications. And what medications are appropriate for children is regulated by the Food and Drug Administration. And then, of course, the USDA has the rules relating to nutrition. I'm old enough that it used to be what are the 4 food groups, and then we had more than 4 food groups, and then we got a pyramid, and now we're doing my plate. But in general, there's this USDA guidelines on how much of which kinds of food is the best for children. And with that, we have the school lunch program and the CACFP program, which we'll talk about later. Different states take on board those guidelines and others don't. But if you are participating in the food program, those are federal laws as to how you need to feed children that affect whether or not you get reimbursed for those meals. And then the last one is education. And so there are a plethora of education acts at the federal level. Not a lot of them apply to early childhood, but some do. There are laws about mandating that children who have identified special needs need to have an individual education plan. Sometimes it's called an IEP, sometimes a 504 plan, different terminology, but basically that the child needs to have a personalized success path through your program. How are you going to support them in meeting the needs that they have because they have an area of development that is way above normal or is subpar, right? So whether the development is gifted and talented, as what people like to call it, or below normal, that child needs to have an individual success plan, and that is a federal law. And then also, the other big one that comes across into your childcare program is, of course, the Child Care Block Grant Fund. It changes names from time to time, but that's what I was taught. And so those are the phrases in my head. I think it has a slightly different name right now. But that program helps fund childcare for low income and middle income families and for those who are students. So that program is called different things in different states, but there is a voucher program, and we're going to talk about that next. Presuming I can push the button. Oh, there it is. The Child Care Block Grant Fund. It is managed out of the Office of Child Care, which is part of HHS, Health and Human Services, at the federal level. Here is a little bit from their website, allowing federal subsidized care for families for all states and tribal governments, and I want to say provinces, but that's the wrong word. So places like Guam and Puerto Rico also participate in the Child Care Block Grant Fund, CCDF programs. And it is paid for with a voucher. Through 2024, that has been a payment that you receive after the care is given. And we don't know at this point exactly when the new payment will be changing, but it is supposed to be changing from a payment in arrears to a payment in advance. So that is a big change, and that's part of why we're doing this new video, is to let you know that if you have a contract with your state agency that manages the Child Care Block Grant Fund, and part of the reason why you haven't been accepting very many people from the subsidy program is because I can't provide care and not get paid for 2 months. That is something that is going to change. Also, the percentage of the family's annual budget that their child care copay will be reduced from up to 15% of the family's income down to a maximum of 7% of the family's income, meaning that the amount that is reimbursed by the state is going to go up and the copays will go down. So that is a change that was announced in April of 2024. When it will go into effect, still to be determined, and each state has the opportunity to manage that in their own way. Okay. Why is it that sometimes? Okay. Now let's talk about local regulation. So we talked about the federal government at the big level. Now we're going to talk about local, and then we'll come back to state, which is the one that people are generally most concerned about. So local, I mean your municipality, your city, your town, your county. These regulations are typically focused on health and safety. So there will be regulations about how many parking lot spaces you need to have based on how big your program is. There will be rules perhaps about signage. Where can your fence be? How big can your sign be? In some cases, what colors can your sign be? All of that is part of the city or county code, the building code. How many doors do you need to have out of each room? How wide do the doorways need to be? All of that is your local building code. Why does it matter how big and where your signs are? Because a really big sign could limit visibility for people in their cars. So they have rules about how far away from the street they have to be, and sometimes what angle to the street and how big, etc. It's also a question of having a unified look in the town in some versions of the building code. There is information about what kind of signage you need to have for emergency purposes. Do you need to have just a printed sign that says, here's the exit, or do you need to have an illuminated sign, and maybe an illuminated sign with a klaxon and a battery backup? All of that is going to be part of your building code. They're also going to have rules about how high the grass can be within a certain distance of the road and within a certain distance of structures. And that has to do with pest control. So your local city regulations can be very extensive related to childcare. Also, of course, your zoning and how big can your childcare program be in that zoning. So if you're looking to expand or to start a new program, you really need to ensure that you understand the zoning rules as well as the building code rules. In addition, you may have interactions with the local fire department or health department because they may need to do inspections. Some of them do them annually. Sometimes they do them just at the time that you start the program. That's going to be dependent on your locality. The fire department is looking at the signage in case of emergencies. Do you have an evacuation plan? Is that posted? Do you have the requisite number of fire extinguishers and smoke detectors, carbon monoxide detectors? Maybe you need to have a fire suppression system. All of that is going to be what the fire marshal or fire department is going to be looking at. The health department is going to be checking the water temperature, the temperature of your different foods, the refrigerator temperature, the freezer temperature, hand washing procedures, diaper changing procedures, making sure that all garbage, which is stuff that has food waste or plant waste in it, is in a covered, sealed container. So a garbage can with a lid. All of those kinds of things are things that the health department is going to be concerned with. And if you are serving food, which most of us do, there may also be an inspection that's pretty similar to an inspection that they do at restaurants. So those are things that we're looking at with our local health and safety regulations. You may also have regulations related to a property owners association, which is the commercial version of an HOA, or of course an HOA if you're a shared use homeowners association. But again, all of these are primarily focused on health and safety. If you are making any changes to your building, you are bringing in a portable structure, you are adding a wall, taking away a wall, adding a water fountain, taking away a water fountain, any change, you need to record it. You need to communicate with the appropriate regulating agency and then record that conversation. How do we record that conversation? Well, we send an email to that regulator saying, to confirm our call, this is what I asked. This is what I said I was going to do. This is what you said was needed. If I have any of this wrong, please let me know within given time frame, usually 5 work days. And then you have a record of the conversation with the regulatory agency, and then you're going to file that away. If possible, you want to copy your supervisor or the regulator supervisor. Okay, we're going to file it and we're going to keep it. So another thing I did not mention is you may also need to do a water test for lead in the water, and that might be annual or it might just be at the time that you start your program. Okay, let's get into the big one, state regulations. Or again, if you're in another part of the world other than the United States, this might be provinces, your not local, but not national government. So you're probably going to have some version of a regulator. I tend to call this licensing. That is a personal bias because that's what it's called in my state. But you want to have a good relationship with your licensing agency. If you don't know what your licensing agency is because you're starting a child care center for the first time, In your workbook, there is a list of the licensing agencies for all 50 states. I do not have the territories and provinces, but I do have all of the states in that workbook. When you're working with licensing, you should be the first one to reach out to them because you're the new person. So you say, "Hi, this is who I am." And you introduce yourself and you ask a question so they have a reason to respond back. One of my favorite ways to do this is to ask them, how do they like the forms kept? Whatever they're going to need to review. The staff files, the children's files, how do they like them organized? Some like them organized by classroom, some like them organized by alphabetical, hire date, enrollment date. There's lots of different ways that you can organize those files, but ask them how they like it, because the licensing file is for licensing. It's not for you. You're going to put things into that file for childcare licensing, and nobody else is going to touch it except you and childcare licensing. You have another set of files, which are your confidential files, and you might have confidential and working files. So you may have 3 sets of files for your employees and your students. And the confidential or the working file is where you put all of your notes, the cool note that the parent gave you about how wonderful it was that you recorded their child during the week that they were first learning how to walk, or a note from a grandparent saying, "Thank you for sending something for Grandparents' Day." All of that is going to go in the confidential or in the working file. The only thing that goes in the childcare licensing file is the stuff for that regulatory agency and nothing else. If they've been working for you for 27 years, not every training certificate for their continuing education needs to go in the licensing file. It will be a couple of years at most of the training certificates. The rest of it should go in the working or the confidential file. So we're going to start by reaching out and asking them a question and maybe telling them a little bit about yourself so that we're starting a good relationship. If you've already been a director for 5 years and right now you have kind of an antagonistic relationship with your regulator, reset it now. Reach out to them and say, "Hey, I just wanted to let you know, we're thinking about making this change. What do you think?" Maybe you're thinking about changing from one childcare management software to another. Ask their opinion. Okay. When they come to visit, set the stage. Ask them if they want to start with their walkthrough or if they want to start with the paperwork. Whichever one they want to start with, that's fine. We're okay with that. And then again, we're going to give them 2 choices. This is just like how we manage children's behavior, right? We give choices that are real choices. So they absolutely can start with the paperwork or start with the walkthrough of the building. It's okay for them to do either one. So if they decide to walk through the building, you're going to walk with them so that if they have questions, if they have concerns, you're right there to answer them, to support them in getting the information they need and in correcting anything your staff is doing wrong so that they can write down in their report, "Corrected at visit," which is a great thing for you to see on a licensing inspection report. If they want to sit down and do the paperwork first, offer them 2 locations that they can work at your desk or on another table. Maybe you have a picnic table outside. Give them 2 options of places where they really can work and let them go to town. And you're going to say, "Hey, as I step out, I'm a little thirsty. I'm going to go get some, I don't know, water, coffee, tea, whatever you're going to step out and drink. Can I bring you some?" Most of the time, they're going to say no because there's some concern about the appearance of impropriety, that you are not maybe that you're trying to bribe them with a cup of water. Of course you're not. We're being hospitable. We're helping them to feel comfortable. If they are working in your office, hopefully you have on your table a bowl that has some sort of little snack item that is child safe. I like to keep lifesavers in individually wrapped containers in a bowl on my desk. So if a child takes it, it's not a huge issue, but it's also there for when parents come to visit or when licensing does. Okay. When you're having the conversation with licensing at the end of their inspection, it depends on the laws in your town, in your state, but I live in a state where I can record that conversation. So I always am going to record that conversation. If you live in a place where that's not legal, without telling the other person, ask them, hey, I'd really like to record the wrap up of your inspection so that I can make sure I have it exactly right. And 9 times out of 10, they're going to say that's okay. Record that meeting. And that way we have all of the information and we know exactly what needs to be changed. If they say no, then just take as complete a notes as you possibly can. That's still recording it, and we're going to file that away. Another thing to keep in mind is that childcare licensing should be seen as a partner. They're working with you to provide quality childcare for all the kids in your program and to help educate your staff about what they should and should not be doing. So it's a good idea to communicate with your licensing rep about once every other month or once a quarter at the minimum. Ask them questions, tell them about changes you're doing in your program, keep them up to date, keep it as a two-way communication. As often as you need to have several times a year, you're asking them questions. Give them a heads up when a parent is really grumpy about something, so that if the parent then calls childcare licensing to report you because you won't do this thing that you can't do because minimum standards or your state regulations say you can't, then they already know about it because you called ahead to give them a heads up. Okay. And we're going to file our notes about all of those things. I don't care whether it's electronic or paper, but we're going to continue to track our conversations. So if we ask, can we do this thing? And they say yes, and then we get a new regulator in 3 months, and that person comes out and is like, why are you doing that? You're like, well, I asked if I could, and Susan said I could. You can show them the proof that Susan did say you can do that. Okay, that'll make things a little bit easier. Your regulations are going to change. They're going to change for lots of different reasons. I'm going to list 5 that are the most common across the states. A federal law changes. Okay, that makes sense. If a federal law relating to childcare changes, then we're going to have to change our standards here in your state or region. The second one, a state law changes. Your legislature passes some sort of bill that affects minimum standards or your regulations. Excellent. Number 3, I call this the dumb rule. Somebody does something dumb at a childcare program somewhere in your state, and they're like, well, that wasn't in standards before. I guess we need to put it in standards. Because it wasn't against the rule. It was just something that common sense would say you shouldn't do. Somebody didn't, somebody did the bad thing, and now we have to put it in standards. For instance, in Texas, there's a rule saying that you can't do any gang activity in a childcare center. Well, of course you can't, but somebody did a dumb thing, and so now that is in our regulations. Number 4, is there some sort of state of emergency? There is a hurricane, there's a tornado, there's a worldwide pandemic. And so there is some sort of emergency order that goes into place relating to childcare. So allowing you to have days where the kids can't play outside because all of the playgrounds and stuff were destroyed because of a natural disaster, right? So sometimes there is a big thing that happens in the world, in the community, and they give you a temporary new set of rules. Okay. So emergency response, those are usually some sort of executive action. And the fifth one is that the agency that oversees childcare regulations may have a systemic way to review the standards. Maybe they're supposed to review it every 5 years, every 10 years, some specific time frame where they, as an agency, review the standards and update them based on what we know now that we didn't know before. So those are the 5 ways that your regulations may change. We want to use this information about regulation in meetings with the parents, with the community, to talk about how we protect children, why maybe the zoning laws should change, and it would make more sense for childcare programs to be right at the edge of neighborhoods instead of in the commercial district. We want to use them in public forums, in public meetings. You also might want to use it in staff meetings, staff trainings. You want your staff to know what the rules and regulations are so that they can comply with them. You may have other meetings that are parent meetings. So we're educating the parents about the rules. And occasionally we use them with the kids because they want to do something. We're like, I would love to let you, I don't know, run around with your pet bulldog. But according to the rules, we can't allow dogs that aren't owned by the school to be in the school because we don't have their vaccination records and we don't have a report from their veterinarian, for example. So sometimes we use the rules to answer questions from the children about why they can't do a thing they want to do. I'm going to suggest that you take a field trip, go through your regulations, and see if you can figure out, like, if you wanted to have something with a piece of equipment like this slide, can you? It is an inflatable slide with water jets and the kids are having a grand old time. Could you use a piece of equipment like this at your program? Make sure you have a list of all the different things that your regulations say that requires that the children, and I don't know, maybe the adults, if this thing happens, we have to wash our hands. Are there specific types of animals that kids can't interact with in your state? In my state, you cannot interact with monkeys. That's in the rules. In your state, it might be something else. And what are things that may happen or that may change at your center that you need to notify licensing of? And make yourself a list of that and put that somewhere for easy reference as well. Go do scavenger hunts through minimum standards on a regular basis with your administrative team and with your staff. It's a fun way to teach this information that is much more engaging than someone standing in the front of the room or on the video and going over point by point by point. Make it interactive when you're teaching your staff and your management team what is in regulations. Okay. I told you we would come back to the CACFP. So this is the federal food program that reimburses you for the expenses incurred in feeding children healthy snacks. If you are a home-based program, you automatically qualify. If you are a nonprofit organization, if your organizational structure is a nonprofit, you automatically qualify. If you are not a nonprofit or a home-based program, you must have at least 25% of the enrolled children meeting the USDA income eligibility guidelines for the school lunch program or free or reduced meals. This one says for the state of Texas, but it's the same in all of the states. I just pulled the one from my state. But this is true for all states. Okay. Some states have added additional funding to the federal money for the CACFP program and do universal meals at certain times. Some states did it during the COVID-19 crisis. Some do it during the summer, but this is the general rule. What is the requirement for the CACFP meals? They have 3 categories of meals. They have something called breakfast. Breakfast needs to have milk, grain, and fruit. So a bowl of Cheerios with milk and a sliced banana is breakfast according to the CACFP. Then they have something called lunch or dinner or lunch or supper. I don't know. Big meal. And it needs to have a protein, a fruit, a vegetable, a grain, and a dairy. And then they have something called a snack, which just needs to have any 2 food groups. And they reimburse you at different levels based on which meal it is. So if it is a breakfast meal, a lunch meal, or a snack meal, you will be paid back at a different rate. So here are the rates for the contiguous states in the United States. This was from 2023, 2024. These rates will change from time to time. I just wanted to let you look at the math a little bit in case you were thinking about the food program but had not yet decided. I think I'm going to feed children anyway. So if I have an economically diverse program or a program that has a large percentage of low income or student families, I'm always going to choose to do the food program because I can get basically the equivalent of one child's tuition for every 9 kids, plus or minus a little bit, without having another child come into my program. And it's reimbursing me for something I was going to spend money on anyway. So it's an easy way to diversify your income stream. I know this isn't the budgeting section, but I did want to talk about this because it is a federal program in the United States that helps to fund childcare. Okay, so thank you so much for listening to me talk about regulations. In case you didn't know, we do have a podcast. You can screenshot this little QR code. The podcast is called Childcare Conversations with Kate and Carrie. We have a lot of episodes and they cover so many different things from insurance to marketing to getting new clients, getting new employees, motivating, budget, all of that we talk about from week to week. We do a weekly podcast, so we would love to have you join us there. At any time, you can subscribe or follow, depending on your app. And just want to make sure you know about all the things that we offer here at Childcare Conversations. We offer in-person classes, we offer online classes, and of course, we offer director coaching and consulting. Reach out to us if you would like some help. I'll see you next time.